Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. President Rodrigo Duterte has now more powers to help combat the coronavirus disease by signing the Bayanihan to Heal as One Act. The president can now realign funds from the 2020 budget to help the poorest and hardest hit families in the crisis. Mr. Duterte gave a straightforward and brief message to the nation last night. He assured the Filipinos that the government is in control. Here's the president in his own words.
Supplies of food, water, and other essentials will be provided to you throughout this ordeal. Financial assistance will also be extended, especially to those in the margins and the vulnerable groups. Halos lahat ho makatanggap.
The number of infections in the country is on a steady rise. The health department says 90 more people tested positive for COVID-19. With more people, actually that total number of cases now stands at 552. With more people getting tested, the DOH says the increase was expected. Health officials are also setting up more laboratories to process results. Earlier, authorities confirmed a senior military officer and a Manila-based police officer tested positive for the disease. AFP Chief of Staff Filimon Santos says he's now on self-quarantine after having been in contact with a senior military officer. Meanwhile, the death toll from COVID-19 has risen to 35. 20 patients have recovered so far. Several hospitals in Metro Manila are no longer accepting COVID-19 patients. Among these are St. Luke's hospitals in Quezon City and Taguig. They say they are caring for 48 confirmed cases of the coronavirus. More than 100 more patients are under investigation or PUIs. Workforce is further depleted as nearly 600 of healthcare workers are on quarantine. Delos Medical Center in Quezon City also says it cannot accept more COVID-19 patients. It admits their protective gear supply is also running low. The hospital adds its intensive care unit and other isolation areas are already full. The Makati Medical Center says it has reached full capacity and cannot guarantee a room for more COVID-19 patients. They are caring for 70 COVID patients. 15% of the ill are confined at the intensive care unit. On Monday, the medical city in Pasig also said it has exceeded capacity with 18 COVID-19 patients and more than 16 PUIs. The health department says that the Lung Center of the Philippines will be one of the hospitals that will focus on COVID-19 patients, but are they ready for the expected influx as more tests positive for the virus? Let's go straight to the source of the story. We have Lung Center COVID Task Force founder, Dr. Virginia Delos Reyes. Dr. Delos Reyes, welcome to the show.
Good morning, Pinky. Morning to everyone.
Good morning, ma'am. Well, the Lung Center is now going to be a dedicated hospital or what they call a referral hospital for COVID-19 patients. Are you prepared for this?
Provided that we're given all the necessary resources, then yes. But we really need the support of the government and also the other sectors to really help our doctors confront this problem.
Let's just talk about which part or which area of the Lung Center will be dedicated to COVID patients. I ask that, Doctora, because there could be other patients who might start feeling a little threatened or insecure by the Lung Center being a referral hospital for COVID-19 patients.
Yes, for now, not all our wards are actually COVID wards because we kept those wards that are dedicated to take care of other patients, non-COVID patients. So that's the reason also that we cannot take all the COVID cases, that just COVID cases, because we're also dealing with multi-drug-resistant tuberculosis, COPD patients, asthmatic patients, as well as lung patients.
All right,
So
Dr.
far,
Pasensya na po, but
our
we
COVID
kind of, sorry, we lost a part of the end part of what you were saying. You said that it's not strictly for COVID patients because you need to attend to other illnesses as well as those with
Right.
tuberculosis, etc., ma'am.
Yes. So we also provide a vital service to our pulmonary patients, not just COVID cases. But we allotted a total of, at this time, we have about 45 of our, 45 already have UI or COVID positive cases. We're already 88% filled up for COVID wards. But the rest of the hospital is really dedicated to serve other pulmonary patients, not just COVID.
Doctora, may I ask you to repeat that? You are 80% capacity of COVID-19. Is that 80?
For the beds that we're allotting for COVID cases, we're about 88% filled up based on our current
I see.
census for today.
Okay.
Yes,
The
and-
question, though, Doctora, is there are private hospitals such as the Makati Medical Center, the Medical City, St. Luke's, Quezon City, and Taguig. They're already saying they're full capacity. They cannot accept COVID-19 confinements inside the hospital or to take in the hospital. Would you say that the lung center will be taking in these patients who may need to be confined for COVID-19?
Yes, probably at some point we're going to be prioritizing the really high-risk patients, those who would need specialized care, those who would be needing ventilators and really strict isolation. So later on, we'll be handling the worst cases, and probably the mild PUIs could be transferred to other hospitals. So we're going to really prioritize the more critical ones.
Understandable. But I need to clarify that you have only 12% left to fill up your capacity for COVID-19 patients. How many
For
patients
now-
would that be, Doctora?
Yes. Beds that we allotted for COVID is just 59 beds around that value. But we could still increase that for a bit, but understand that the other areas are already dedicated for non-COVID cases, as I mentioned earlier. So it's just a small hospital, but at the most, probably 60 beds. But of course, we will respond to as the situation will evolve.
I want to talk about your frontliners. How are they? How many are in quarantine?
So far, actually, so good news for us because initially there were like five of our fellows who were quarantined, but it turned out that they're negative for the tests. So they're back in the front lines already.
So is there anyone, no more in quarantine right now, Doctora?
There's still some doctors who are in quarantine, but we're hoping for the best.
What about supplies? Tell us more about the supplies that you need. I remember reading an article, Doctor, I think it was Monday, that the Lung Center was saying that you need supplies of PPEs and isolation gowns. How is the situation right now in the hospital at Lung Center?
It's pretty much fluid at this point because there will be days that we'll be getting a lot of donations. But our need right now is really for the hospital gowns, the impermeable ones, because we really need a lot of changes within per shift. And it's also not only for doctors, but also for nurses and the other support staff. So if there's really a priority, I think it's really the PPEs, which really need to take care of our patients.
I read an article, Doctora, that last Monday it said that you only had 98 suits left as of that Monday, and by the end of that day, mauubos na po ito. Did that happen?
Actually, because of the help of the public, because it was sent out in Viber, in Facebook, so there'd been a lot of donations since then. But really, we need the support not only of the donations from the private groups, but the government steady supply that we're assured that we have that steady supply based on our needs and not just donations from the public.
But that's the thing, Doctora. If you're a referral hospital, the lung center, you must have a steady supply of the PPEs and the gowns because you're the referral hospital. What kind of supplies are you getting from the government? Do you get it every week, every 3 days? What is it like?
I think things would be better after the announcement yesterday of the president. But let's just say we need at least 200 isolation gowns per day. So this is for 1 day. All right. So
Yeah.
I think because we're already designated as a referral center, I'm
That's right.
really hoping all the resources for us and our workers.
So right now, let's make that clear. The lung center needs about at least 200 gowns per day.
200
And that could be more,
gowns
Doctora.
per day, yes. It could be more as we get
At
more
least
patients.
the isolation. Yeah. Go ahead, Doctora.
Yeah, so 200 isolation gowns per day. So I'm talking about the full PPE, along with the
Yeah, the whole
N95,
thing.
safety, goggles,
Yeah.
gloves,
Yeah.
the whole set.
Okay. Yeah, we're not just talking about the gowns that we see that you wear. It's the whole thing. It's from top to bottom. Doctora, that's what you mean. That's 200 at least a day.
Yeah, because understand that every time you
All
see
right.
a patient, you have to change. Yes.
You need to dispose of that. Hindi ho ba, Doctora?
Right. Yeah. Okay, we cannot reuse. So per patient, we have to change
Yeah.
the whole PPE, the whole set.
All right. So just maybe, Doctora, to those watching us right now, what do you want to tell the public?
It's actually, we also had another initiative. It's called the Lung Center COVID Task Force. So this was set up along with former students of mine from the Ateneo School of Medicine and also with the Lung Center of the Philippines. So this task force is an online platform. And it's amazing that since we started a week ago, we were able to get, we already have reached 300,000. We're doing 1,000 online consults per day. Okay, so it's a way of
Wow.
limiting or decongesting our front lines, our triage areas. And initially, there were just 3 of us in the group, but now it's ballooned to 625 doctors from the different hospitals, but mainly from the Ateneo School of Medicine. We have subspecialists with us, internists, intensivists, and also even the students, the medical students are teaming up with us to provide support for this group. So I think this is something worthwhile access to health right now for our countrymen. They've been disconnected from their doctors for a long
Yeah.
time. And at least
Yeah.
with this online
Yeah.
platform, we're able to reach out to them, give the information, and then allay somewhat their fears. So consider it sort of a virtual hug or handshake.
That's
So
right.
not everything's
That's
depressing.
good news.
Yes.
It's good to hear, Doctora.
Yes. I think it's.
All right, I'm sorry, but we're really. Okay, our line is
Right.
not very clear anymore. To Doctora Delos Reyes of Lung Center, that's a bit of good news. Ma'am, if you're still hearing me, maraming salamat po sa inyo. Thank you for your time. You're watching The Source on CNN Philippines. When we return, the Summer Games concedes to the coronavirus. We'll explain right after the break. You're watching The Source on CNN Philippines. The COVID-19 pandemic is affecting various aspects of our lives. Never have we seen these many people getting sick of the same illness in every corner of the world. Never have we seen hospitals so overwhelmed. President Rodrigo Duterte has signed into law a measure that gives him additional powers to help the country combat the coronavirus disease. Let's take a closer look at the impact of President Duterte's additional powers to address the coronavirus crisis? Let's go straight to the source of the story. We have Senator Risa Hontiveros. Senator, welcome to the show.
Thank you, Pinky. Good morning at sa lahat ng ating mga tagapanood.
Thank you for your time. Senator, you voted no to the Bayanihan to Heal as One Act. Why?
Well, basically, Pinky, tingin ko hindi na kailangan yung emergency powers sa pag-secure ng pondo para sa mga panawagan ng publikong tulong laban sa COVID-19. Political will lang talaga ang kailangan. Our current laws and mechanisms already provide that help. Halimbawa, yung mandatory reporting of infectious diseases law, yung Procurement Act, yung Price Act, among others. Ang punto ko ay pwedeng abusuhin ang pag-allocate.
Senator Risa? I think we lost Senator Risa Hontiveros on the line. We're going to try to get her back in a bit. She's the only senator who voted no to this Bayanihan to Heal as One Act. The senator telling us that there are enough laws, there are enough programs in place that the president actually doesn't need these additional powers to combat the COVID-19 disease. Basically, the senator. All right, she's back on the line. Senator, you're back. Welcome,
Yes,
welcome again to the show.
Thank you.
You were saying that there are enough laws.
Yes, there are enough
Senator,
laws.
you were saying there are enough
mechanisms.
laws, no?
Yes.
Okay.
There
And
are
mechanisms in
enough laws.
place. However,
Yes. Well,
however,
ang punto ko
you
ay
have about 18.
18.
Pasensya na, Senator, go ahead.
Yes, Pinky. So yes, our current laws and mechanisms already provide the help for the public against COVID-19. Ang punto ko pa ay pwedeng abusuhin ang pag-allocate ng pondo at mga programa because the law allows the president to move funds and savings of any government agency and any government-owned and controlled corporation or GOCC under the general criterion of 4 anti-COVID-19 actions. Now, paano natin masisigurado na mapupunta ito sa taong bayan? But ngayong napirmahan na yung bill, I'm focusing on the moving forward part. Pinky, I really hope that those funds... Hello, Pinky? Hello?
I'm here, Senator. Go ahead.
Yes, Pinky. So I really hope that those funds will get to what the people need most. Personal protective equipment that you were talking about with Dr. Delos Reyes of the Lung Center, cash assistance to our poor and near poor Filipino families, mass testing, my gosh, mass testing, more facilities. Gusto ko sana makita yung mga nauna ka nang naging rekomendasyon, for yung cash assistance at hazard pay na maibibigay talaga sa ating mga frontliners at sa mga pinaka-vulnerable at risk na mga mahihirap na Pilipino. We'll closely watch the implementation, Pinky, to protect against overstepping of powers. At ngayon, mas mataas na expectations ng publiko sa gobyerno sa pag-respond dito sa crisis. So, the people shouldn't be let down. And of course, most of all, Pinky, saludo ako sa ating mga frontliners, no? Sina Dr. Delos Reyes, ang ating mga health frontliners at iba pang mga frontliners, ang mga private companies at mga volunteers, no, mga kababayan natin na totoong nagbabayanihan. So tulong-tulong po tayong lahat dito.
Sa palagay niyo po, Senator Risa, so far, what they're looking at is about 5,000 to 8,000 pesos depending on the cost of living doon sa mga pamilya na 18 million low-income earners. For now, palagay niyo ho ba ay makakaraos tayo sa ganitong klaseng siguro 5,000 to 8,000? Will this be enough to tide us over?
Oh, that's our question, Pinky. Originally, nananawagan ako ng initially 10,000 pesos per family na hindi na makapasok yung breadwinners, hindi na makasahod araw-araw. So at least mayroong 5,000 to 8,000 pesos per family in the next 2 months at least. Alam po natin na mas maliit pa na halaga pa lang yan. Pero sige, panimula. Let's get it to the families lalong-lalo na yung mga, dahil nga sa lockdown, hindi na makapasok, hindi na makasahod araw-araw at lalong hirap na makabili ng pagkain, gamot, let alone health supplies, mga basic needs natin sa pang-araw-araw. So isa itong cash assistance, isa itong importanteng babantayan namin at babantayan ko rin mula sa Senado na makarating talaga sa mga mahihirap na kababayan natin.
Senator Risa, you are the Vice Chairman of the Committee on Health. Kayo po ay Chairman dati. Ano po? Kayo ho
And
ba,
former
frankly,
Chair of
nangangamba
Health, still Chair of Committee Women and Children.
Yes.
Yes.
That's right. Kayo ho ba'y nangangamba dito sa mga, yung St. Luke's Medical Center, Quezon City, Makati, Delos Santos, Makati Med, sinasabing we're full capacity, we cannot take in
Yes.
more people coming in, pwedeng on an
Medical City
outpatient.
Yes.
Opo kasi puno na po sila. Paano
Opo.
na ho, is this something that's worrying you?
It's really very worrying, and I didn't catch the whole of your conversation with Dr. Delos Reyes, but I'm almost sure she expressed a similar worry. Like the public health experts and other experts like Tomas Pueyo are saying, we really have to flatten the curve. We have to buy time. Pueyo talks about this hammer and dance strategy, but basically we have to buy time by adopting the WHO suggestion, strong recommendation on mass testing. The WHO says test. Let's learn from best practices like countries like South Korea. We have to buy time, PC, for our health system, not to be overwhelmed, not to collapse, but in fact be able to, for example, through mass testing, establish the baseline, identify those who are sick, isolate them, care for them, saluhin yung ating triage system na bumibigay na kasi pati yung ating mga frontline health service providers nagkakasakit, yung iba namamatay na, pati yung family cardiologist namin, halimbawa kahapon si Dr. Raul Hara. We have to enable our health system to catch up, to up their capacity, to take care of us. At saka bukod sa COVID-19, which is our urgent concern, andyan pa yung mga comorbidities natin kasi hindi naman natigil yung mga kababayan natin na kailangan i-manage halimbawa yung kanilang HIV status or yung mga kababayan natin na dengue at iba pa. Or people who have emergencies like heart attacks o kung ano man, people still have to be brought by ambulance, for example. People still have to be admitted to ER, attended to by a doctor, na hindi nagko-collapse yung health system under the weight of this COVID-19 pandemic. So we have to buy time to allow our hospitals to take care of us. And we have to take care of each other, Pinky. Yan ang isang napakagandang value ng WHO sa public health emergency preparedness. Yung duty to care, no? We take care of ourselves, of each other, and all other people. And in that way, we help our health system to take care of us.
All right. Senator Risa Hontiveros, ma'am, as usual, thank you for your time.
Maraming salamat, Pinky. Mabuhay kayo. At be well and stay healthy.
To you too. Finally, a decision on the upcoming Summer Olympic Games in Tokyo. Japanese Prime Minister Shinzo Abe and the International Olympic Committee agree to postpone the Olympics by about a year. They were scheduled to happen from July 25th to August 9th. CNN's Will Ripley reports.
The signs are all over Tokyo, symbols of what was supposed to be a Japanese revival, a comeback, crushed, at least for now. Tokyo 2020 organizers and the International Olympic Committee bowing to global pressure brought on by the novel coronavirus catastrophe. Memories of another disaster 9 years ago still fresh on many Japanese minds. 2011's mega quake, tsunami, and Fukushima triple meltdown. Winning the Olympic bid in 2013 brought a surge of national pride and badly needed jobs. Japan invested tens of billions of dollars, new infrastructure, new technology. 2020 was supposed to be a banner year, a year now defined by a once-in-a-century global pandemic. We've overcome natural disaster, war, but things are different now. This will be the biggest challenge we ever face, says Shigeru Ishiba, one of Japan's most powerful lawmakers. He says Japan's aging population and shrinking workforce makes it much harder to bounce back. The Olympics are a cornerstone of Prime Minister Shinzo Abe's plan to transform Japan into a global destination, a plan to jumpstart the Japanese economy. Analyst Keith Henry says even a delay has serious financial implications.
Basically, it's a service sector economy, obviously, with the railroads, the hotels, the regions of Japan that are counting on people spending a few days in Tokyo, then wandering the mountains or the beaches of the hinterlands of Japan. The damage, economic damage, will be widespread all across Japan.
Finance Minister Taro Aso even went so far as to call coronavirus proof of an Olympic curse. Aso was born in 1940, when World War II extinguished Japan's Olympic flame. Tokyo was supposed to host the canceled 1940 Games. It would end up waiting 24 years. The 1964 Tokyo Olympics, Japan's reintroduction to the world, showcasing a miracle recovery, rising from the ashes of war. Today, a new war against a deadly virus, putting Japan's Olympic dreams on hold yet again. Will Ripley, CNN, Tokyo.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.